Welcome to today's presentation, a critical review of the therapeutic powers of play within the context of play therapy. I'm your host, Melissa Cumming, play therapist in training. Before we commence, I would like to acknowledge the traditional custodians of the unceded lands, skies, and waterways on which we come together today. I would just like to take a moment to acknowledge these two quotes regarding play therapy. There are many models of play therapy that have evolved over time. Today's presentation will focus on three theoretical approaches of contemporary play therapy: humanistic, systemic, and emerging. Each of these theoretical approaches have multiple related models. However, this presentation will focus on three commonly utilized models. Let's first look at the humanistic theoretical approach with a specific focus on non-directive play therapy. Non-directive play therapy, also known as child-centered play therapy, is a model that was first shared through the work of Virginia Axline and was based on her study of Carl Rogers' person-centered therapy approach. To summarize Sweeney and Landreth's chapter in Foundations of Play Therapy, this model centers around the child and their capacity for growth and self-discovery, rather than on the child's age and stage of development. It differs to other theoretical models, as the therapist is not there to focus on diagnosis, symptoms, or prescriptive techniques, but rather is there to facilitate and join the child through self-discovery. The belief underpinning this model is that a child can grow and heal when an environment conducive to growth and free from agenda is provided. Humanistic play therapy models, such as child-centered play therapy, are defined by their focus on a child's natural tendency for growth and their capacity for self-evaluation, regulation, and socialization, while also recognizing the importance of the child-therapist relationship in facilitating growth. The therapist creates a safe environment by showing empathy and genuineness so that the child can use play as the medium of communication to connect with the therapist. Child-centered play therapy has many applications, ranging from addressing commonly occurring childhood concerns to more significant life events such as anxiety, depression, grief, and trauma. This model of play therapy is most beneficial for children aged 3 to 12 years, with the focus on addressing behavioral and emotional concerns and improving a child's well-being and ability to learn and grow. The model of play therapy may be used as a tool prior to the diagnosis of disorders such as ADHD, obsessive compulsive disorder, and biochemical depression, as it can assist in determining if a child's symptoms are acute or rule out if they may be due to developmental delays or adjustment problems. Children with clinically diagnosed neurological, biological, or organic disorders may also benefit from the use of child-centered play therapy, as children with these disorders often have additional emotional and behavioral concerns. However, it is important for both parents and professionals to understand that this model of play therapy should be utilized as an adjunct service and not be seen as a treatment or cure for diagnosed disorders. Now we will look at the systemic theoretical approach to play therapy with specific focus on filial therapy. Filial therapy was created by Bernard and Louise Gurney in the late 50s and early 60s and was developed as an extension of child-centered play therapy. The model engages the child's parents as the primary change agents in the therapy session. The role of the play therapist is to train parents to use non-directive play therapy principles which allow their child to freely express their feelings and fears and communicate their wishes. The therapist supervises the parents throughout the sessions. As they become more confident in the process, these sessions can be conducted in the home environment. The overall aim of this model of play therapy is to enhance the relationship between parents and their children by empowering the parents through a short-term intervention that will have lasting effects. Systemic play therapy models, such as filial play therapy, are defined by their focus on the child within a system. This can include their family, their school, a healthcare setting, or broader systems such as their culture. Systemic play therapy models are designed to support the child within the context of one or more social systems. The use of filial play therapy has a number of applications. It first serves as a tool to strengthen the relationship between parent and child. However, its use may also be appropriate in more critical circumstances as a form of therapy for families experiencing mild to severe problems, or as a preventative approach to offset potential problems in at-risk families. There are, however, some instances where filial therapy would not be a suitable model of therapy. This can be related to either the child or the parent and involves such conditions as outlined here. The final theoretical approach we will look at is emerging, with specific focus on learn-to-play therapy. Learn-to-play therapy was developed by Karen Stegnetti. This model engages competent adults, such as parents, teachers, or therapists, to direct and implement the program. The program uses a directive approach through play scripts and aims to build a child's ability for spontaneous play that is both consistent with their age and stage of development. Learn-to-play therapy involves a framework for assessment, goal setting, and directions on how to scaffold the intervention to suit the needs of the child. It involves a series of therapist-directed activities that gradually challenge the child. As sessions progress, the intent is for the child to be supported to take the lead in play. The use of learn-to-play as a model is most suitable for children aged between 18 months and 10 years. It is particularly helpful to assist children with developmental delays, autism spectrum disorder, and those who find play difficult. As this is an emerging therapy, there is limited evidence on the contraindications of the program. However, it is important to note that children participating in the program must have a developmental age above 18 months and have at least one meaningful word, gesture, or focused attention. Now I'll introduce you to the Therapeutic Powers of Play by Charles Schaefer. This framework allows therapists and other health professionals to understand what, why, how, and when play will create positive change for their clients. To gain a better understanding of this framework, we will explore how the therapeutic powers of play can be applied to the systemic model of filial therapy. The therapeutic powers of play, known as TPOP for short, identify 20 powers of play that can produce positive change in patients. Schaefer highlights the importance of understanding these powers of play as they allow for medical and allied health professionals to provide a targeted approach by matching the impacts of a concern to the relevant therapeutic power of play. These 20 powers of play have been categorized into 4 areas. These are: facilitates communication, increases personal strength, fosters emotional wellness, and enhances social relationships. According to the research of Lucy Griffin and Judy Parson, all powers of play except counter-conditioning of fears are activated in filial therapy. However, today we will look at just 8 of these powers of play. The first category we will explore is facilitates communication. Schaefer and Drews describe play as the natural language of children and therefore an easy way for children to express their thoughts and feelings. Direct teaching involves the therapist imparting knowledge or skills through instruction, modeling, guided practice, and positive reinforcement. This applies to filial therapy as the parents are upskilled by the therapist to be the facilitators of change. Direct teaching can occur through filial therapy as the play between the parent and child captures their attention, allows both parent and child the opportunity to consolidate skills and learn by example. Self-expression is a part of communication, creativity, building understanding, and expressing emotions. As mentioned previously, play is the natural medium of communication for children, and therefore play is a tool for self-expression in children. In filial therapy, The therapist's role is to integrate both the child and parent's preferred mediums of communication in order to create a safe space and strengthen their relationship so change can occur. The second category we will explore is increases personal strengths. As highlighted by Schaefer and Drews, play can promote a number of personal strengths that assist clients to overcome both internal and external concerns. Self-esteem is the feeling of confidence in your thoughts, feelings, and actions, whilst also having a sense of worth. In filial therapy, this power of play is activated both in parents and children, but is particularly evident in parent outcomes. In this model, the parents are the agents of change rather than the therapist. This type of therapy creates opportunities for parents to gain and practice skills, which has been reported to increase their confidence in parenting and create feelings of competence, excitement, and pride. Self-regulation is the ability to regulate our executive functions, such as impulse control, working memory, internalized language, and cognitive flexibility. In filial therapy, this power of play is activated in the therapist, parents, and children. The role of the therapist is to assist parents in learning the skills of self-regulation so that parents can co-regulate with their children. This has a direct impact on a child's ability to control their emotions and has shown to decrease incidents of temper tantrums among child participants. The third category we will explore is enhances social relationships. Schaefer and Drews explained that throughout child development, play can promote social development and create feelings of attachment, empathy, and respect for others. Griffin and Parsons' work demonstrates that enhances social relationships is the category of therapeutic powers of play that is most frequently activated within filial therapy. Empathy is the ability to comprehend the thoughts and feelings of others, with the ability to empathize having a significant impact on social relationships. A child's experience with adults in their life greatly impacts their development of empathy. In filial therapy, this power of play is activated in the relationship between parent and child and parent and therapist. The therapist's role is to both show and teach the skill of empathy to the parent through role play, storytelling, and reflection. By receiving empathy from the therapist, the parent's ability to show empathy to their child is greatly enhanced. Social competence is a combination of social skills such as conversation, cooperation, and empathy, which create positive peer relationships. Obtaining these social skills in childhood leads to positive outcomes in adult relationships. Play is a safe setting for children to learn and practice these social skills. This power of play is activated in filial therapy as it facilitates improvements in social competency for the whole family. Parents that participated in filial therapy expressed that their children had fewer incidents of externalizing behavior and improved social skills. The fourth and final category we will explore is fosters emotional wellness. Schaefer and Drews explain that play strengthens the emotional health and well-being of clients while creating opportunities to develop awareness and control of distressing feelings. Stress management refers to techniques used to help someone cope with or decrease the effects of stress. Children who do not find effective coping mechanisms for stress management are more likely to experience negative impacts in adulthood. As parenting stress increases, parents are more likely to adopt negative parenting styles, which result in an increase of child behavior problems. Filial therapy is designed to address parental stress, with the therapist teaching parents play techniques to improve the relationship between parent and child. Research shows that by participating in filial therapy, parents experience less strain both as individuals and as a couple. Positive emotions can be expressed both verbally and through behavior. Play creates opportunities to experience, explore, and develop an understanding of the many positive emotions. This experience of positive emotions in play can have many emotional, psychological, cognitive, physical, social, and behavioral benefits. In filial therapy, this power of play is activated in the relationship between parent and child, with the parent being involved in the therapy through the medium of play, the whole family experiences the positive emotions activated by play. Thank you for your time today. This concludes my presentation on the therapeutic powers of play within the context of play therapy. Please pause the video on the next slide to take note of the references used to inform this presentation.